Hi and welcome. I'm trying to learn medicine, today asthma, and after we've done it, we're going to do stretching. And if you participate in the stretching, then it's at your own risk. And this is no medical advice, we're just learning about it. And this is about internal anatomy and also an illness. Asthma. Asthma is a word which often conjures up a frightening picture of patients fighting desperately to get their breath. So it is understandable that many parents may be apprehensive when we hear a child wheeze. Okay, wheeze seems to be a sound, I don't know exactly. But wheezy breathing is common in young children and usually does not indicate that true asthma is present or will develop later. Asthma occurs when the small bronchial passages in the lungs become swollen with inflammation, partially obstructed by phlegm, or narrowed when the muscles surrounding the air tubes become tight, bronchospasm. Okay, and that causes the characteristic wheezing sound. Okay, let's read it again. Okay, the small bronchial passages. And the lungs, there seems to be a place where the air passes through, and these seem to be the bronchial passages. And they are becoming swollen because they are inflamed, or because they are obstructed by phlegm, so substance in between them, or they became narrowed because the muscles are doing spasms, bronchospasm. Okay, they are either swollen through inflammation, obstructed through a substance, phlegm, or narrowed because the muscles are tightening around them. And that causes the wheezing sound. And that is when asthma. Some babies go through their first year of life with noisy, sometimes wheezy, breathing which is normal for them. As they grow, the small air tubes enlarge and the wheezy breathing disappears. So again, take this not as a medical advice, but they're saying here that some babies can have it in the first year. But I would add here now, see a doctor if you're unsure. Asthma tends to run in families. And again, here, this book is 40 years old, so maybe things are outdated. Asthma tends to run in families, and in one form, it is associated with the inflammation of the skin, eczema. Okay, first of all, there's some type of inflammation of the skin, eczema, because we're learning medical about all diseases, eczema. And that might have also something to do with asthma. Asthma may appear for the first time in childhood or in adolescence. I still don't really know what adolescence means. People use it, but they don't say what it is. Certainly don't really define it. Adolescence, I think it's with the teenage years more or less, but it's if you don't look it up, you don't find it out. And I'm not going to look it up. Adolescence, often as an extension of hay fever. Okay, it can come through the childhood, that can happen the first time, and then also during adolescence as an extension of hay fever. It can also appear out of the blue later in life, the so-called late-onset asthma, which can be much more disabling than other forms and is often associated with recurring chest infections. People can develop late-on asthma, or at least can they appear. It is then associated with, oftentimes with chest infections. Does that mean that there can come a chest infection? Does sound to me like a virus or whatever. Does that mean that a virus can cause later on asthma? Or is a chest infection something else or something like that? True asthma is a respiratory problem, but the symptoms may be confused with cardiac asthma, which occurs at night in older patients with serious heart disease. Okay, or some people, most of the times older people, they can have heart diseases, and these symptoms of these heart diseases can then be a little like asthma. Asthmatic bronchitis, sometimes called chronic obstructive airway disease, COAD, may develop after recurrent attacks of bronchitis. Okay, asthma bronchitis exists, or asthmatic bronchitis. It's also sometimes called chronic obstructive airway disease, COAD, chronic obstructive airway disease. Asthmatic bronchitis or asthma bronchitis, I don't know. And that can develop after recurrent attacks of bronchitis. But bronchitis is something which can come after infections, I think. That means infections can cause it. Symptoms: cawing, wheezing, and difficulty in breathing. The main difficulty, okay, that is a bit too much, but we're going to read the next time on. So we're making two parts here. That was no asthma. We had now basically that it can be inflammation when the airways are swollen. They can be obstructed by phlegm, or they can be narrowed, that is bronchospasm. Some babies in the first year can have a similar wheezing sound, which is then not asthma sometimes. And it can also set later on in life. It can be confused with other serious heart diseases, or it can be developed after recurrent bronchitis. No bronchitis. And it has maybe also something to do with eczema, and it runs a bit in the family. Now, in the next part, we will continue with asthma, the symptoms and so on. If you were here for medicine and asthma, go directly to the next part of the video. Next part, we will do now the stretching. If you participate in the stretching, then it's better the risk. We are bringing one leg up, and we're doing the mushroom, just point the foot down. And take the other leg up, and point the foot down. Now the legs wide apart, and we're breathing in again slowly down, and out and up, and breathe out. Breathe again in, out, in, out, again in, and out. Now breathe in and cross the legs, and out. Now the legs a bit more and shoulder width wide apart. Breathe in, lift the arms up. And breathe out, we're going over to one side. Breathe in and out, rib cage. And breathe out, back into the middle. Breathe in. And out and go over to the other side. Breathe in and out, rib cage. And breathe out into the middle, and the arms down. Next exercise, now one sees your Cooptera. You're breathing in. And breathe out, and one hand slides down the leg, and the other shoulder stays down. And breathe again in. And out, and we're taking one arm over. Now breathe in and out, rib cage. And breathe out, back into the middle. Breathe again in. Out, one hand slides on the leg, breathe again in. Out, we're taking one arm over. Breathe in and out, rib cage. And breathe out, back into the middle. Now the legs are standing together. No, legs standing together. We're breathing in, lifting the arms up, the Nordic aerobatic airplane. And breathe out, lift one hand down. And breathe in and stretch to both directions. And breathe out. Again in. And out, the other arm comes down. Breathe in and reach. And breathe out, one hand up. And out and hands down. Now we're doing the Niagara Falls. Legs are standing wide apart, breathing in. And we're breathing out, and we're hanging down. We only have to come deeper down by breathing deep in through chest into the nose. And we're breathing out through the mouth. Again in. And out. And again in. And out, we're going over to one leg. Breathe again in. And out. And again in. And out, we're going over to the other leg. Breathe again in. And out. And again in. Out into the middle. And we're closing the feet. We're doing the Salto Angelo. Just keep hanging down. Breathe again in. And out. And again in. And out. Again in. And out, we're coming slowly the round back up and making it top a bit. we're doing more shoulder rounds. Go to stable standing, and we're doing backward shoulder rounds. Back, down, shoulders, front, up, back, and down, and again. And the last time. And now, forward, back, up, front, down. One last time. Now we're moving in the three shoulders up. And breathe out, let the foot down. Again in. And out, let the shoulders fall down. Again in the arms up. Shoulders. Out, let the foot down. And we're doing the other plucker. Breathe in, lift the arms up. And reach always with one arm high. Pretend to take an apple. Hanging high on an apple branch. To turn it a bit around. And then to harvest it. And the last two. And now we do the shifter. Arms up to a T and breathe in. And out, going over to one side. Breathe again in. And out over to the other side. Breathe again in. Out again over to the first side. Again in. And out over to the first side, second side. Again in. And out, we are leaning onto the knees. Now breathe in. And out. Bring one shoulder in front, the buffalo fighting its hangover. Breathe in the shoulder back. And out, shoulder in front. Breathe in the shoulder back. Out the shoulder in front. Breathe in the shoulder back. And out the last time the shoulder in front. Breathe in. And out, and we're hanging again down. And this time we're breathing just in. And out, and you're coming slowly upwards, round back, making at the top again, and shoulder roll backwards. Now the garland pose. We're also pointing to the outside. We're having an ulnar space between the heels. We're breathing in, lifting the arms up. And breathe out, and we're sinking down. And we're placing the elbows against the inside of the knees. Now breathe in, straighten up the back. And breathe out, and we're coming with the back up. Breathe it in. And out, and coming down again. Breathe in, straighten the back up. And out another time with the back up. Breathe again. And out and going down. Breathe in, straighten the back up. And breathe out, we're coming slowly up in one straight line. And bring the arms down. And we're ending the legs wide apart. We're breathing in. And slowly down. Breathing out. Again in. Out. And again in. Last round. Out. Again in. Out. Now breathe in and close the legs. And again out. And that was the stretching. I thank you very much, and until next time.